After a very fast lockdown from March until April 2020, Malaysians reported that they were actually doing fine. 85% had enough food, 94% had enough space, and 90% felt safe in their neighbourhoods. Many reported that lockdowns was a time of reflection and growth. More than a year later, in and out of lockdowns in a way we have never expected, this is no longer the case.
Malaysia is reimposing a full lockdown.
COVID-19 is taking a mounting toll on mental health.
Over 400 people ended their lives tragically in the first 5 months of this year.
Whether unemployed and facing financial stress, working from home and handling childcare stress, whether there's tension in your family relationship or you're feeling lonely from living by yourself, we are all feeling the mental pressure.
We do see an increase in the number of calls that we received, and we also did a comparison between the start of MCO, March to May 2020, and then we compare it to the same period, March to May, a year later, 2021. And here we could see there was an increase of more than 50% in the number of contacts that we received. More and more people are being affected emotionally.
Mental health is defined by the World Health Organization as a state of well-being in which an individual can realize his or her own potential, cope with the normal stresses of life, work productively, and make a contribution to the community. Poor mental health means that you're not in this healthy state of being.
So there's a difference there between mental health issues and mental illness. Everyone has mental health, and sometimes our mental health gets affected once in a while. But when it becomes too bad, too unmanageable, to the point that it's becoming disruptive, you're not functioning, then it becomes a mental health disorder.
Health Director General Dr Noor Hisham
has mentioned that tremendous stress and being isolated from a support network of family and friends make mental health issues like depression more likely. But also that addressing the feelings and getting treatment are important in protecting against lethal outcomes. Although this season has brought more awareness of the need for mental health care, there is still a stigma and fear about having a mental illness.
Stigma definitely is an important barrier to people seeking help because of lack of understanding of the issue. Other factors may be because of limited resources also, due to financial issues maybe, or not knowing where they can go to, not having enough support from within their own family members, for example, making the decision to go and see a professional, it's actually not that easy.
Based on a research survey conducted by the Malaysian Psychiatric Association,
85% of youth were worried that seeking mental health care may affect their career prospects.
67% were embarrassed to seek help for their mental health. 52% were also worried about negative family reactions.
Unfortunately, this fear is often founded.
I had a child who was, a teenager who seek help through the teachers, but the teachers cannot bring this child in because you have to bring the parents together. But when the child tells the parents that I'm depressed, I'm feeling like this, the mother say, no, you shouldn't speak like that, you must back up and whatnot. So this mentality of the older generation that perceives it as not a psychiatric problem stop this child from getting help. Okay. So what happens is this child decides, okay, you don't want to listen to me. He attempted suicide. Okay. Ended up in the hospital and he was referred to us. So he finally got the help. What saddens me is the fact that the parents cannot take this as a cry for help from their child.
Sadly, it's quite common. If only people can start seeing, because there's a lot of studies showing that some of these conditions, it is memang evidently due to the neurochemical imbalances, and if you can see the amount of patients improving with medications, right, then they would treat it as a medical condition, and when something happens, you're sick, you get help.
In Malaysia, there are an increasing number of private mental health services. However, some estimates have put the cost of private treatment for depression as high as 8,000 ringgit per year. Charges at government facilities are significantly less, at around 200 ringgit a year.
We have 56 hospitals over the whole country that offers mental health services. So we have 30 hospitals, general hospitals, that have beds If you are mentally unwell and you need to be admitted, you can be admitted in a general hospital, less stigmatizing. And we have now what we call Mentari. Okay, Mentari, we have about 22 Mentari now. This is a facility that is in the community where you can walk in, you can be assessed by them, whether you need further treatment or not, then you'll be referred to the hospital. And we have 1,000+ clinic that can see or can manage and can diagnose people with mental health issue. And if they have problem, they will be referred to the hospital for further treatment by the psychiatrist.
Experts have warned that mental health issues are set to become the greatest threat to public health in the developed world.
So are these services enough?
Reports show that there is a shortage of mental health professionals at every level, from counsellors to clinic psychologists and psychiatrists.
As of this year, we have 600+ psychiatrists already. In Ministry of Health, about 300+. And clinical psychologists, sadly, in the Ministry of Health, is about 20+. But wow. we are part of a team. We work together with the psychiatrist and also the medical officer.
I think there's a lot of clinical psychologists practicing privately, but I think the KKM especially needs more. I think if we can get more, definitely it will be a great addition.
This will require significant funding, but it has been shown that every dollar invested in scaling up treatment for common mental illnesses, such as depression and anxiety, leads to a return of $4 in better health and ability to work.
Mental health is an area that many nations are struggling with.
A study by The Economist showed that only 1/4 of Europeans affected by mental health get any treatment at all, while just 10% receive notionally adequate care.
The answer is not just the volume, but the strategy.
Germany, Denmark, the UK and Australia are some of the top performing countries in terms of mental health services. In Australia, the National Mental Health Service Planning Framework provides a stepped care approach where the level of care provided increases according to the severity of the illness. It moves from the well population, who are encouraged to use publicly available information and self-help resources to stay well, all the way to those with severe mental illness, who are treated by an interdisciplinary team with inpatient treatment, pharmacotherapy, psychosocial support. In the UK, the National Mental Health Strategy takes a life course approach. It recognises that teaching good mental health and intervening early in childhood and teenage years are key in preventing mental illnesses from developing and mitigating their effect if they do.
There are efforts to create similar programs here, both from the government and NGOs.
We have been answering requests from mainly universities and sometimes schools to run programs for them, awareness programs on self-care or on suicide prevention, as in the skills, listening skills. How do you support people from who are struggling? It has been quite positive, I would say, because we are seeing an increase in number of requests from year to year, not only from universities, but also from corporates now. So that's a good sign.
There is a program called Minda Sehat that is put in schools, but actually I feel you shouldn't make a program for like just mental health, because my daughter tells me when she goes for a program or something talk on mental health, people ask, are you not well? Are you something wrong with you? The stigma is still there. I think you should make a program that is wholesome. You add to the physical, you add the psychological. The Ministry of Education or Ministry of Health, I think we are working so that we have a program that is more wholesome.
One thing is for sure, mental health concerns are only increasing. We must first accept that fact so we can start reforming the system to address this critical concern.
Do check out the links below on the technique of unhooking and grounding to manage stress and take a few minutes a day to check in with your mental health. This is Tara Shaker for Breaking Down the Issues.